Hello everyone, my name is Cristal T. Hormachuelas and I will be discussing to you my topic about hyperlipidemia. My objective for my topic are the following: define hyperlipidemia and lipid, discuss the biological importance of lipids and its types, discuss the causes and risk factor of hyperlipidemia, discuss the symptoms of hyperlipidemia, identify the classification of hyperlipidemia and its subtypes, and discuss the prevention and treatment for hyperlipidemia. Hyperlipidemia is a human genetic disorder where lipids in blood are extremely high. In a diagram, it is shown the difference between a person's body with healthy cholesterol levels and a person with hyperlipidemia. I would like you to have a glance with that picture because I will explain that later after my discussion about the types of lipoproteins such as LDL, HDL, triglyceride, and the two others which I will discuss later. So let's define lipid. The lipids are the heterogeneous group of compounds related to the fatty acids that are insoluble in water but soluble in ether and benzene. A lipid is a term for a fat or fat-like substance in the blood. The body stores fat as energy for future use, just like a car that has a reserve fuel tank. When the body needs energy, it can break down lipids into fatty acids and burn them like glucose. So the biological importance of lipid are the following. First, it serves as an efficient source of energy stored in an adipose tissue. Second, it serves as an insulating material in the subcutaneous tissue and around certain organs. Third is lipoproteins, fat plus protein, and glycolipid, fat plus carbohydrate, are essential for maintaining the cellular integrity. And the fourth one is the phosphatides of blood platelets are involved in the production of thromboplastin activity in early stages of blood clotting. Now we move on to the types of lipoproteins. First is the chylomicrons. It is obtained from diet. It transports fats from the intestinal mucus to the liver. Second is the very low density lipoprotein or the VLDL, which is the source of lipid is liver. It helps in endogenous triglyceride transport. The third one is the IDL, which stands for intermediate density lipoprotein, which is the source of lipid is VLDL and its function is to transport the cholesterol esters to liver. The fourth one is the LDL, which stands for low density lipoprotein, which is the source of lipid is IDL and it transports the cholesterol to tissues and liver. LDL is sometimes called the bad cholesterol because a high LDL level leads to the buildup of cholesterol in your arteries. And the fifth one is the HDL, which stands for high density lipoprotein. The source of lipid is tissue and cell membrane and its function is removal of cholesterol from tissues. It is sometimes called the good cholesterol because it carries cholesterol from the other parts of your body back to your liver. Your liver then removes the cholesterol from your body. So in the picture above is a more likely what our fats that is inside our body would look like. In the picture, the orange color thing represents your LDL or the low density lipoprotein. The triglyceride is in color green and HDL is in color yellow that are circulating in your body together with red blood cells. So it is important to note that LDL is a bad cholesterol and HDL is a good cholesterol. So because it is a bad cholesterol, it should be less. So goals for lipids. So guys, remember the following numbers or you may take note of the normal level of your total cholesterol, HDL cholesterol, triglyceride, and LDL cholesterol so that you may be more mindful and watchful to the food you eat. So the desirable level for total cholesterol is lesser than 200 milligrams per DL. For HDL, the desired goal is 40 to 50 milligrams per DL. And for triglyceride, the normal level is lesser than 150 milligrams per DL. And for LDL cholesterol, the desirable level is lesser than 100 milligrams per DL. Causes of hyperlipidemia. The following are the causes of hyperlipidemia. First is the hypothyroidism. It is a disorder of the endocrine system in which the thyroid gland does not produce enough thyroid hormone. Next is the nephrotic syndrome. It is a kidney disorder that causes your body to excrete too much protein in your urine. Next is anorexia nervosa, in which a person lacks the desire to eat because of intense fear of gaining weight. Then obstructive liver disease, obesity, diabetes mellitus, pregnancy, acute hepatitis, and AIDS. So risk factor of hyperlipidemia are the following. First is cigarette smoking. Cigarette smoking raises levels of LDL or bad cholesterol and a blood fat called triglycerides. Second is alcohol. Drinking too much alcohol can actually increase your risk for heart disease and stroke, raise blood pressure, contribute to obesity, and increase levels of fats called triglyceride. Third is hypertension or high blood pressure, who's having blood pressure above normal, which is 180 over 20 millimeters of mercury. Fourth one is low HDL cholesterol. Fifth is a family history of premature coronary heart disease. And the last one is age. Men aged 45 years or older and women aged 55 years or older are at higher risk of high cholesterol and heart disease. The following are the signs and symptoms for hyperlipidemia. First is atheroma, plaques in blood vessels. Next, xanthoma, plaques or nodules composed of foamy cells in the skin, especially the eyelids. Next is tendinous xanthoma. The xanthoma deposits in tendon. The fourth one is a corneal arcus, lipid deposits in cornea, and other signs like diabetes mellitus and coronary heart disease. So there are two classifications of hyperlipidemia. First is a primary hyperlipidemia, which is genetically determined. So which means it is hereditary. It has 6 subtypes. First is the type 1, which is known as the familial hyperchylomicronemia. Increased lipoproteins is the chylomicrons. Type 2A is the familial hypercholesterolemia. Increased lipoprotein is the LDL. Type 2B is also known as the familial combined or mixed hyperlipidemia. Increased lipoprotein is the VLDL and LDL. Type 3 is the familial dysbeta-lipoproteinemia. Increased lipoprotein is the increased IDL. Type 4 is the familial hypertriglyceridemia. Increased lipoprotein is the VLDL. And the last one, type 5, is the familial mixed hypertriglyceridemia. Increased lipoprotein is the VLDL and chylomicrons. So, let's talk about the secondary hyperlipidemia, which is acquired. There are 2 types of secondary hyperlipidemia: hypercholesterolemia and hypertriglyceridemia. Hypercholesterolemia is associated with hypothyroidism, nephrotic syndrome, and drugs. Second one is the hypertriglyceridemia. It is associated with diabetes mellitus, alcohol, gout, chronic renal failure. Complications of hyperlipidemia. First is the macrovascular complication. It is due to damage to larger blood vessels, includes unstable angina, chest pain, myocardial infarction, heart attack, ischemic cerebrovascular disease or stroke, and coronary artery disease or heart disease. So the next complication is the microvascular complications. So microvascular complications are due to small blood vessels. Included in microvascular complications are retinopathy, which is vision loss, nephropathy, which is a disease of the kidney, neuropathy, or the loss of sensation in the feet and the legs. Diagnosis. Laboratory test for hyperlipidemia is a fasting lipoprotein profile. It is a blood test that measures your total cholesterol, LDL, HDL, and triglyceride. Should be measured in all adults 20 years of age or older at least once every 5 years. Measurement of plasma cholesterol, triglyceride, and HDL levels after a 12-hour or longer fast is important. Because triglycerides may be elevated in non fasted individuals, total cholesterol is only modestly affected by fasting. Treatment for hyperlipidemia. The following medications or drugs are used to lower lipid levels. First is the HMG-CoA reductase inhibitors. Second is the fibric acid derivatives. Third one is a niacin. Fourth is a bile acid sequestrants. And the fifth one is the cholesterol absorption inhibitors. So the following are prevention for hyperlipidemia. First is diet control. A diet rich in fruits, vegetables, whole grains, beans, and good fat can help lower your LDL cholesterol. Next is lifestyle. Change your lifestyle, such as quit smoking and drink alcohol in moderations. Third one is exercise. Exercise helps boost your body's HDL or good cholesterol. You need exercise on most days of the week for at least 30 minutes. The fourth one is control of risk factors, example, diabetes mellitus, obesity, and renal diseases. And the fifth one is avoid drugs that increases plasma lipids. Examples are contraceptive pills, corticosteroids, thiazides, and beta blockers. So that's all for hyperlipidemia. Thank you for watching and listening, and I hope that you learned something from my topic. Thank you. So that's all for hyperlipidemia. Thank you for watching and listening, and I hope that you learned something from my topic. Thank you.